So we're going to go ahead and take a look at inflammation and the inflammatory responses that lead to disease and illness here. So inflammation is controlled by various signals, both local paracrine and autocrine signals, as well as global endocrine signals. Most of these are going to attempt to control the overall flow of fluid through the systems, as well as to attempt to trigger a response so that you will immobilize the area that is damaged. Bradykins are going to change the flow rate through the tissues. CRPs are going to change vascular adherences. Serotonin is going to change the permeability as well as induce vascular spasming within the tissues. Chronically, we're going to get a change where we're going to start seeing additional cortisol in circulation, interleukins in circulation, TNFs in circulation, more CRPs. We're going to get additional serotonin. In this case here, serotonin is generally going to start causing pain reception to take place. We're going to start seeing a more global fever response, mainly because we're going to start seeing a hormone known as pyrogen going into circulation. We're going to see systemic responses, both catabolic as well as anabolic responses, based off of the level of inflammation in terms of pro-inflammatory versus anti-inflammatory signals. We can be stuck in a catabolic state for excessive periods of time where we minimize the amount of anabolic responses that we get, a condition known as anabolic dysregulation. The chronic responses is what leads to the formation of illnesses due to tissue exhaustion. This is where we have to remember a key feature here. Illnesses and infections are not the same thing, nor is infections the same thing as a disease. Illnesses and disease is the terminus of the chronic excessive stress response that we see within Sales gas responses, in which we get the neuroendocrine response to stress, leading to chronic tissue changes, leading to exhaustion within those tissues. Excessive exhaustion leads to the conditions that we reference as illness due to dysregulation of metabolic processes, as well as dysregulation of hypothalamic conditions that will not allow for proper thermoregulation. What ends up happening is that a hormone known as pyrogen goes into high circulation. And what this does is resets where the POA, the preoptic and the anterior hypothalamic nuclei within the hypothalamus, will trigger when excessive heat has been reached. So let's take a look at the stress response. And once again, we're going to follow Sales. And so we always start with alarm. And so what we're going to end up getting is we're going to end up getting the alarm response to the stress. And once again, we cannot differentiate between whether it is psychological, physical, or immunological in terms of stress. What we'll see is we'll see an increase of blood glucose. We'll see an increase of fatty acids within circulation as well as triglycerides. We will get the cardiovascular shifts and cardiovascular drifts in association to the stress response. We get localized specific responses within the tissues, hopefully enough response to eliminate the stress. The problem is that we don't always eliminate the stress, which means that we start getting increased levels of interleukins and cytokines going into circulation, which is going to go ahead and trigger the localized responses that we see within the tissues, leading to the initiation of the next stage. So we haven't taken care of the stress. We haven't taken care of any of the stresses. And so the next phase is where we're going to get the initiation of resistance, where we're going to start seeing an increase of ACTH, causing an increase of cortisol, as well as an increase of aldosterone, as well as an increase of adrenal androgens. From the cortisol release, we're going to start seeing a change of metabolism indicated by having the resistance pick up. Within the resistance picking up, what ends up happening is we'll start seeing an increase of blood glucose. We're going to start seeing more increase of amino acids, as cortisol starts to catabolize proteins, in particular the collagen proteins within the connective tissue. We're going to start seeing an alteration of leukocyte and lymphocytic function based off of cortisol regulation of intracellular genes and proteins, in particular kappa B proteins. We're going to start seeing localized and tissue disturbances, as well as a continuation of a generalized response. Hopefully we get enough response to initiate a reduction of stress. However, that's not always the case. And because it's not always the case, what ends up happening is that an increased level of interleukins and cytokines trigger an additional sense of fever, where this fever now starts becoming systemic as we start having release of hypothalamic protein pyrogen. And what pyrogen is going to do is it's going to reset the thermostat that's going to take resting body temperature above 37°C and take it closer to 40. What that 40°C is going to do is it's going to attempt to induce an inhospitable environment for the pathogens, as well as increase the level of lethargy within the person so as to make them want to relax. Because if we can get them to relax, we can alleviate some of the stresses that they might be facing. So we haven't been able to eliminate any of the stresses. Since we haven't been able to eliminate any of the stresses, we reach a point of exhaustion. This is where alarm and exhaust and resistance are compounding on each other, leading to tissue breakdown, altered states of energetics and metabolic dysregulation, and we start getting a generalized response, a generalized adaptation to the stress. This generalized adaptation to the stress is what leads to disease and illness. What ends up happening is that excessive amounts of breakdown cause dysregulation. This dysregulation will continue and continue and continue until we can finally alleviate the stress. Until we alleviate the stress, disease and illness will take hold. This is where having things like chicken soup, having things like bed rest when you are feeling sick comes into play, because what it does is it alleviates some of the compounding effects that are taking place in between the alarm and the resistance phases of the responses. The bed rest and the chicken soup, it doesn't cure, but what it does is it changes some of the energetics. What it does is, particularly when we look at the soup issues, is that it provides nutrients, it provides amino acids, it provides lipids, it provides carbohydrates, it gives fluids so you stay hydrated, it provides electrolytes so that you can stay hydrated. It's usually associated with some sort of comfort, and because it's associated with some sort of comfort, what it does is it lowers the level of cognitive stress. And as I lower the level of cognitive stress, I can start to alleviate the various stresses that I have in my body. If you cannot eliminate any of the stresses that take place, you start compounding the stress upon the stress upon the stress upon the stress. And as you compound the stress upon the stress upon the stress, the body is unable to withstand any of the immune responses that it must undergo. And that is where you start to develop the disease and the illness state. The disease and the illness state may not actually come about because of a pathogenic entity. In this case here, we have what are referred to as non-communicable diseases. The non-communicable diseases are nothing more than this cascade of events due to stress that stems from a metabolic and a cognitive psychological origin as opposed to an infectious origin. The other thing that comes into play in terms of inflammation is the concept of healing responses to injury. Injury is nothing more than a response to an internal pathogenic response, meaning that you have some sort of tissue damage that's taken place, where we're going to involve the lymph system as well as the immune system in terms of repair and recovery. Generally speaking, we have 5 distinct responses that we'll see within the tissues that are going to take place that tell me there's an injury that has occurred. This includes localized fever, localized swelling, localized redness, localized tenderness. These are the same reasons why you get muscle soreness and burning. These are regulated by serotonin, bradykins, as well as NF-kappa B. All of the injury and inflammation responses we're going to take a look at here are all geared to limit total amount of swelling so that we can allow for proper tissue repair and regeneration. If we cannot control the inflammatory response, we end up developing scar tissue in place of the normal tissue that we should have. Inflammation is a non-specific defense mechanism that is attempting to self-splint the area. It's regulated by cytokine signaling. There are 5 distinct symptoms that we will see within the area that has inflammation. This includes redness, pain, heat, tenderness, and swelling. The stages that we're going to look at in a second here are going to indicate how worse off we have in terms of total tissue repair, as more inflammation leads to a prolonged tissue repair, and prolonged tissue repair leads to less functional tissue at the end. There are 3 distinct phases. The first phase is the vasodilatory phase. In vasodilation, what ends up happening is we're increasing blood flow and capillary permeability. This is done through 2 distinct signaling mechanisms. Extracellular mechanisms through histamine and serotonin release, intracellularly through the regulation of the kappa Bs, either NF-kappa B or IKB, which is primarily a cortisol-regulated pathway. Inflammation is governed by Starling's law, which is going to dictate the direction of motion of fluids based off of the combination of hydrostatic and osmotic pressure. Where if we look at the tissue that has damage, we get a change of flow rate through the tissue. We get a collection of intracellular debris that act as a hydrostatic attraction and osmotic draw. This leads to water leaving the capillaries and heading into the tissues due to interstitial changes. We can regulate how much swelling takes place by following the Rice principles: rest, ice, compression, and elevation. By doing rest, ice, compression, and elevation, what we're able to do is we're able to change the hydrostatic pressure outside of the capillaries, compression, the permeability and flow rate, icing, hypothermia, the flow rate through the capillaries through elevating the limb, and the total amount of damage that will take place through rest. The second phase of the inflammatory response is the macrophagic activation and migration. This is due to chemoattractant signals into the area, primarily done through granuloleukocytes, basophils, eosinophils, and neutrophils, as well as lymphocytes. There is some migrational signals that will take place due to macrophages. This step is attempting to clear out any of the debris that happens to be there so that we can start the repair process. So if we look at the inflammatory markers that are going to come into play in terms of the cycle of attracting the various immune cells into the area, we're going to get movement, emigration into the area from the capillaries. These macrophages will then undergo mitotic divisions. The other immune cells will undergo chemoattractant signal release, which will draw more macrophages into the area. What we're attempting to do is we're attempting to clear the debris fast enough so as to establish normal osmotic conditions within the tissue so that we can keep total inflammation low. The greater the inflammation we have, the poorer the healing process will be. One of the things that's going to regulate overall inflammation within the tissues is cortisol. So cortisol is going to act two ways. It's going to stimulate some genes to undergo translation to proteins, and it's going to stimulate some genes to repress translation into proteins. So if we look at the activation sequence, what we're attempting to do is we're attempting to activate genes such as PPARs and IKB, which is going to reduce total inflammation. It's going to change the release of proteins into the interstitial regions so as to lower the total amount of inflammation that will take place. These same proteins within the cell will limit the amount of NF-kappa B that gets produced. Cortisol will also limit the production of 3 distinct proteins and 4 distinct gene activations, such as IL-1, TNF-alpha, and COX-2, which are all proteins which trigger further inflammatory responses, and will lower the rate of PPRE gene expression, which is going to reduce the rate of receptor activations. What this whole sequence is doing is attempting to produce a targeted immune response by lowering the amount of inflammation that takes place. A lot of the anti-inflammatories that we consume are meant to assist the cortisol processes within this pathway. Most of the prescription anti-inflammatories are predominantly going to function on the COX-2 pathways. By focusing on the COX-2 pathways, what it does is it limits the total amount of inflammation that will take place. So by allowing the tissues to go ahead and start their repair process in a much more normalized fashion. So the last bit of inflammation that will take place is what's referred to as the tissue repair phase. The tissue repair phase is controlled and regulated by an angiogenic pathway. We have to get new capillaries and new arterioles into the area to allow for tissue to repair. This whole pathway, in terms of both the angiogenic pathway as well as the tissue repair pathway, is controlled and regulated based off of pro-inflammatory to anti-inflammatory balance of hormones, where if the pro-inflammatory set of hormones is greater than the anti-inflammatory set of hormones, we get a limited amount of resolution and a greater likelihood of going towards exhaustion. Whereas if we get more anti-inflammatory than pro-inflammatory, we're able to cycle back towards resistance and then back towards alarm and then out of the whole entire response to either infection or injury. The inflammatory process will take place to both injury as well as infection.